Woo, what a year. I have worked in health professions education my entire career. 2020 has been the toughest by far. No other year comes even close. Hundreds of thousands of Americans have lost their lives to COVID-19. This is an unspeakable loss and includes more than 1,000 health professionals who died after caring for patients with COVID-19. We mourn the nurses, respiratory therapists, emergency medical technicians, pharmacists, physicians, and many, many others who died in service to their patients and whose memories we honor. All Americans had their lives turned upside down in 2020, and our health professions students were no exception, but their response to this pandemic has been inspiring. They volunteered to help in whatever capacity they could, as contact tracers, as childcare providers for health professionals who were working impossible hours. Their commitment to service and volunteerism speaks volumes about their character. Residents in our graduate medical education programs were redeployed from their planned educational rotations to crisis clinical situations. They continue to work tirelessly. Learning institutions and their faculties adapted as well by innovating and embracing remote learning, advanced technologies, advanced simulation, many with Macy Foundation grants and developed by Macy faculty scholars. In fact, 2020 represents the 10th year of our Macy Faculty Scholars Program. The pandemic has also shined a bright light on systemic inequities that affect the quality and longevity of life for people of color. This disproportionate impact, combined with last summer's Black Lives Matter protests, have catalyzed an urgency to eliminate discrimination and racism from all aspects of American life. The Macy Foundation pledges our full support. Addressing bias and eliminating discrimination in clinical learning environments for health professionals was the subject of our annual conference this year. We adjourned from that conference with a set of recommendations to change those learning environments all across America and enable equity and inclusion to be a part of those environments. So, what does 2021 hold? With the vaccine approved, we will make great progress on COVID-19. For now, we must remain vigilant with hand washing, masking, and distancing. I am hopeful that policymakers at the highest level of our government will again listen to scientists and health professionals when making critical policy decisions. I am excited to continue working with health professions leaders, educators, and their learners all across America, and I am so grateful to be a part of that community. Together, we can improve clinical learning environments that better align with 21st century needs and that produce outcomes for patients, health professionals and their learners, and the communities that we serve that are better. I am hopeful that as the year progresses, I will have a chance once again to see and work with many of you in person. But until that time comes, I wish you a wonderful new year and stay safe.